The International Conference on AIDS and Sexually Transmitted Infections in Africa continues in Durban today. Global leaders are gathered to explore ways to end the epidemic by 2030. Yesterday, Health Minister Dr Joe Phaahla said the COVID-19 pandemic has set government back in its fight against HIV and AIDS. We're joined for more on this by the Deputy Director at the Africa Health Research Institute, Professor Thumbi Ndung'u. Thank you very much, sir, for your time this morning. What has been your assessment in terms of the continent's battle against this pandemic?
Nick, so thank you very much for having me on the show. We have, over the past 40 decades, we have made a lot of progress against HIV, particularly over the last 2 decades. With antiretroviral therapy now available, we have a lot of modalities for HIV prevention. But HIV still continues to be a problem. Obviously, it is still the most significant public health problem that we face in sub-Saharan Africa in particular. But there is no doubt that we have made a lot of progress, particularly over the past 2 decades.
It still remains the most significant public health problem, yet we have a target of getting rid of it by 2030, a tad bit ambitious.
I think it is doable, actually, in terms of at least getting rid of AIDS as a disease. I think it's going to be a little bit more difficult to eliminate HIV transmission, but certainly what we have seen is that if people go on antiretroviral treatment, if you put people on antiretroviral treatment, which is now widely available in most African countries, you can reduce the risk of people developing AIDS and people dying from HIV infection. So I think that we can eliminate AIDS by 2030 if we work together as communities, if we work together as governments. And unfortunately, we are beginning to see an erosion of the efforts towards the elimination of AIDS, particularly as a result of the COVID pandemic. But I think that elimination of AIDS by 2030 is an achievable goal, and we should all work towards that goal.
What are some of the steps that we need to take in order to achieve that, right? So you speak of a hindrance of COVID-19 somewhat. What about the kind of conversations that we're still continuing to have in 2021 where it's still stigmatized, right? Where people find it even difficult to have this kind of conversation with their most intimate?
I think you're right, Druzilla. I think the most important aspect of HIV prevention, first and foremost, is putting people on antiretroviral treatment. Antiretroviral treatment is the most effective way to improve the quality of life of people living with HIV, because antiretroviral therapy suppresses viral load to undetectable and leads to recovery of the immune system. And so therefore it is the most effective way to control the pandemic. And not only is antiretroviral therapy effective in improving the lives of people who are living with HIV, but it also actually prevents HIV transmission. We have this saying that treatment is prevention, because when you reduce the viral load to undetectable, the person who is HIV infected cannot then transmit the virus to somebody, to a sexual partner, for example. So I think that has to be the cornerstone. And unfortunately, we still have a lot of people who are not yet on antiretroviral therapy. In South Africa, for example, out of about 8 million people who are living with HIV, only about 5 million people are on antiretroviral therapy. So we need to bring those numbers up so that we are up to 95% of people who are living with HIV on antiretroviral therapy, and ensuring that those people are actually adherent to antiretroviral therapy. But the other thing that I think also is to make sure that we eliminate stigma. So especially now, because you have antiretroviral treatment and you have also good prevention modalities, really we need to work on reducing stigma. We need to regard HIV infection as any other disease, so that people can access care, so that people can access services without feeling that they are being stigmatized for the disease that is not their fault.
Indeed. Thank you very much for your time this morning. Africa Health Research Institute, Professor Thumbi Ndung'u.